Angelicus and its Spurb.
Hello, and welcome to the 67th episode of Spurb's Herbs. Today we're going to be talking about a really interesting herb called Citri, reticulatae, Exocarpium rubrum, or much more simply, red tangerine peel. So let's get into what we're going to be doing today. Today we are going to be looking at another single Chinese herb, that Citri, reticulatae, Exocarpium rubrum. I was trying to do that fast for fun. A qi regulating herb whose strength actually lies in its ability to treat phlegm, damp coughs, and vomiting and belching. As usual, we will explore all the intricacies of this herb as well as an explanation of its category. And of course, we will look at something a little different. We are going to look at the risk factors for drug-herb interactions. So please stay tuned for another interesting episode. Before we get into that, however, I wanted to ask you guys, did you know that I have written a couple books? The first book that I wrote, and it's a bigger book, is Integrated Pharmacology, Combining Modern Pharmacology with Integrative Medicine. This is a pretty thorough book discussing pharmaceuticals, what they are used for, how they work, and how they may interact with other drugs, herbs, and supplements. It is the perfect reference book for all acupuncturists, herbalists, chiropractors, naturopaths, and really any integrative practitioner. But it is also perfect for anyone. It goes in depth, but it is easy to read and has difficult terminology bolded with definitions on the exact same page. This is not only a great book explaining pharmaceuticals, it's also available at an amazing price. It's available for 10% off its regular price, and you get it signed by me, the author, all for just $67.45. Now, that may sound like a lot of money, and it's for a book these days that isn't cheap. But when it first came out, it was $110. Hardcover. It was a nice book, but it was almost double this. So this is a real steal. My second book, written with an amazing insurance expert, Tiffany Anderson Hefner, is called Playing the Game: A Step-by-Step Approach to Accepting Insurance as an Acupuncturist. This is a perfect book for any acupuncturist who wants to or is even contemplating accepting insurance. What's great about it is the very first chapter says, should you even accept insurance? And then it goes into everything that you need to do so you can make an informed decision. So it's really good. If you're not sure you should or you shouldn't, it's a really good book. It goes through all the pros and cons of accepting insurance. It gives step-by-step advice at every part of the insurance game, from getting set up through the patient encounter and, of course, getting paid. All in easy to digest language, honest advice, and lots of hand-holding through the process. And you guessed it, it also is 10% off and signed by one of the authors, me, all for $26.98. That's a lot more reasonable. That's an easy one. And you can get either or both of these books at the shop at www.spurbsherbs.com. That's Spurbs Herbs, just like the title of this podcast, SPERBSHERBS.com. I always spell it out because I taught for several years in Australia, and every time my students loved it. Every time I'd say herb, they would always raise their hand and go, excuse me, I wasn't a doctor at that point. Excuse me, Mr. Sperber, do you mean herbs? And I look at them and I go, no, I mean herbs. So it's just a little fun. Anyways, let's get into drug-herb interactions. So here we are on our 67th episode. We've not discussed in depth something near and dear to my heart, as well as something we discuss at least a little bit in every episode: drug-herb interactions. This is a topic I've lectured about internationally and have several courses available on www.integrativemedicinecouncil.org. That's COUNCIL, integrativemedicinecouncil.org. Here I'm going to take excerpts from my very popular 1-hour course, 7 Steps to Avoid Drug-Herb Interactions. This is also adapted from the book we just discussed, Integrated Pharmacology, Combining Modern Pharmacology with Integrative Medicine. Basically, there are four major areas to look at when trying to determine the risks for drug-herb interactions. There's actually a fifth one, which I'll mention at the end, but it's a little bit broad. It's not really a risk, but we'll talk about it. These all involve the drug side of the drug-herb interactions. In other words, we need to look at how much of a risk a drug poses for an interaction. This is because we know a lot more about drugs than herbs. This is changing rapidly, and we are learning a lot more about how herbs can interact with drugs. However, it is still in the beginning stages, and I'll tell you those areas that we know a little bit more about on the herb side of this equation. But for now, we really need to look at kind of the drug side of the equation mostly. The four areas of concern are protein binding, cytochrome P450 interactions, transporter protein interactions, and a narrow therapeutic index. So let's start off with that first, which is protein binding. And when it comes to drugs, most are hydrophobic, which means they do not like being in water. And the reason why drugs are hydrophobic, we can get into a long discussion of it, but basically is because a drug needs to be mostly hydrophobic, maybe a little hydrophilic, meaning it likes water. It mostly doesn't like water, with a little bit of it does like water. And what that does is it facilitates the ability of the drug to go through the cell membranes and get to where it can do its work. So generally, almost all drugs are mostly hydrophobic or water disliking. Because of this, they need to be transported around in the bloodstream by being attached to proteins that basically hide the hydrophobic drugs by surrounding it with hydrophilic protein. You know, most of our water, something like 98% of our blood, 98% of our blood is water. And so, you know, there's a lot of really important stuff in that other 2 to 5% that's out there as part of the blood, but most of it is water. So if you have, you know, a hydrophobic drug and you put it in blood, which is mostly water, it doesn't mix well. Just like water and oil don't mix well at all. Water and fat they don't mix. And so that's not good. Actually, you know, some aspects of that are, you know, can contribute, not in this kind of context, but can contribute to heart disease and things along those lines. So we generally don't want hydrophobic drugs just sitting in the blood. It can't really. So it's bound to these proteins, and a drug that is bound to a protein is not available to do its actions. So, you know, whatever portion of a drug is part of it, is when it's bound to the protein, it can't get out of the bloodstream, go to its site of action and do its work. It's stuck in the blood doing nothing, basically. There's very few drugs that actually work in the blood. Each drug has an inherent, in fact, I can't think of any, so I'm going to say almost none. There might be a couple out there, but most of them don't work on the drug. Even those that affect the blood, excuse me. Each drug has an inherent affinity for being bound with highly protein-bound drugs being over 95% bound to a protein at any given moment. So if you look up a drug and you're looking at maybe a more technical reference, it will say something like this drug is 50 to 60% protein bound, or it's 70 to 80% protein bound. Whatever it is, it's a relatively, there might be a range because everyone's a little bit different, but it's a fairly stable range that that amount of drug is going to be protein bound when it's in the body. And it's a percentage, which means that as a dose goes up, more of that drug gets bound so that the percentage stays about the same. That might be a little bit mathy for some people, but that's basically it. The real definition we want to know here, though, is that definition of what is a highly protein-bound drug. And that's because those are the ones that we're worried about. We'll talk about that in just a second. But by definition, if it's over 95% bound to protein, it is called a highly protein-bound drug. And it goes up from 95%. There are drugs that are 99.9% protein-bound. In other words, only 0.1% of the drug dose is actually doing the drug's actions. So that is really an interesting sort of thing. So let's talk about how this plays out. So if you have a 95% or a highly protein-bound drug, that means only 5% or less is actually available to act on the body and does all the work of a drug dose. So it's a little bit more complicated than this because, you know, I don't want to get into it too much, but really what's happening is a drug is being bound and unbound, bound and unbound, but when it's 95%, binding, a higher protein binding, it's bound and it's unbound. Bound. It's unbound. Well, if it's 50, it might be bound, unbound, bound, unbound, sort of even between the two. But when it's 95% or higher, it's rapidly it's staying mostly bound. And if you have 5% or less of the drug that's actually free and doing its actions, it also means that a very small displacement of a bound drug can add a large amount of unbound and active drug. In other words, if you have 1% of a drug that is actually unbound doing its work and you put in an herb or another drug, that changes the binding from 99% to 98% bound. That's not a huge difference in the big ballpark of things. But the unbound part doubles. It goes from 1% to 2% unbound. That's huge. That's like doubling the dose of the drug. So this can cause something similar to a drug overdose with potentially toxic consequences. Therefore, drugs that are highly protein bound are at higher risk of a drug-herb interaction because it is possible for an herb to cause some release of a bound drug and causing increased adverse effects or serious consequences based on that. So the first of these inherent issues for drug-herb interactions is protein binding. If a drug is highly protein bound, it is more likely to have the risk of a drug-herb interaction. It's just a risk because we don't know what will actually displace that in terms of herbs, not at this point anyways. Okay, so our next risk factor is cytochrome P450. We still don't know much about the herbs that can displace a bound drug, so going back to protein binding, but that changes for our next risk factor, as there has been a lot of research in determining cytochrome P450, or CYP for short, interactions caused by herbs in the last decade or so. Cytochrome P450 is the most common enzyme within the liver used to convert or metabolize a drug or herb constituent into another chemical. Usually, not always, but usually this is to facilitate the elimination of the drug or herb. Interference at one or more subtypes, especially 3A4. So there's lots of different types of cytochrome P450. These are called isomers or subtypes. And so they're similar to each other, but just enough different that there's specificity, which means that some drugs will work with them and other drugs won't. And so one of the most important subtypes for drug-herb interactions is 3A4. So interference at one or more subtypes, especially 3A4 of this enzyme, could cause more or less of a constituent to be available to the body and therefore may cause an overdose or underdose situation. Cytochrome P450 can be inhibited, induced, or just used. A drug is said to be a substrate of cytochrome P450 if it's just used. If cytochrome P450 is induced, it means it will do its actions faster, while inhibited, it does it more slowly. If it is necessary for elimination, inducing can mean a drug may be eliminated more quickly and more slowly when inhibited. Possibly. Like I said, usually it's used for elimination. Sometimes cytochrome P450 is used to make a prodrug or a non-active version of a drug into an active version of a drug. So a prodrug into a drug. In that case, inducing it would increase the activity of a drug. By far, the most common way is to prepare it for elimination, but there are a certain amount of drugs that are taken in as a prodrug and made into an actual drug with cytochrome P450. If a drug is a substrate, it may compete with other substances that require that cytochrome P450 isomer. And what that means is it's probably not a huge issue if it's a substrate. Like if you have a few drugs or herbs that are substrates of cytochrome P450, there's probably plenty of the cytochrome P450. You don't really have to worry about it. But there's a certain what we call a major substrate. In other words, it uses a lot of the cytochrome P450. And you start combining a couple major substrates, then we have this competition happening, and we might have some issues with the cytochrome P450 basically it's competition, which means it's sort of the same as being inhibited. It's not really inhibited, it's the same amount, but less of it can act on each drug that the drug needs it to act on that would normally be acting on it, or drug or herb. If a drug, said that, I keep trying to repeat myself. Cytochrome P450 3A4 is used to metabolize about 40 to 60% of all drugs. So that's a lot of drugs out there. The next closest is cytochrome P450 2D6 with about 20% of the drugs utilizing 2D6. So you can see why we're particularly worried if a drug or herb affects cytochrome P450 3A4, that we're more worried about having an interaction happening. That could be an important interaction. And we are, like I said, we are starting to learn about the herbs. A lot of the major herbs now have been assessed for cytochrome P450, especially 3A4 interactions. Though I got to be honest, when I see, stuff that looks at cytochrome P450 interactions in herbs, it's not that much harder to just add in other probes for the different types of cytochrome P450. So they're usually doing several of the isomers. But usually 3A4 is the main target. And so we're doing that research, and we have an idea about herbs that can affect 3A4. The one issue with the research that's happening around cytochrome P450 in herbs is often what they will do is they will separate the constituents of the herbs and say, okay, this constituent of this herb interferes with cytochrome P450. Well, that's great and dandy that we know that, but clinically, when it actually comes to human beings, it doesn't mean that the herb in its whole is going to, because there could be constituents that induce cytochrome P450. There could be other constituents that inhibit it, and we don't know where that lies, overall for the herb as it's taken in. And of course, herbs, because of soil and because of growing conditions, can change in these constituents as well. So it's good to know that there's a constituent that might be an interaction, but it's not necessarily proves that there's something that's going to happen in an individual who's taking a drug in that herb. There you go. Okay, so this is cytochrome P450. Our next one here is transporter proteins, with P-glycoprotein being one of the most researched and the first, I think, of the transporter proteins. There's others out there, but usually it's easier to find information on P-glycoprotein. But like I said, when they do research on P-glycoprotein, they usually throw in probes for the other transporter proteins as well. But P-glycoprotein seems to be more common in the body and more of an issue at this point. So transporter proteins transport molecules from inside of the cell to the outside of the cell. There's a lot of really interesting research happening around this, because this is a major area. P-glycoprotein is how a lot of chemotherapy loses its effects over time as the body adapts to it. One of the ways it adapts is it increases P-glycoprotein. It induces P-glycoprotein, so it keeps the chemotherapy out of the cell. So there's a lot of research, like, can other drugs or substances actually inhibit P-glycoprotein, because then the chemotherapy can work better. And the other transporter proteins are in that research as well, but P-glycoprotein is a huge area of that. So P-glycoprotein can interfere with several steps of how a drug moves through the body and has the potential for many interactions. Just like cytochrome P450, a drug can induce, inhibit, or just be a substrate of P-glycoprotein. Just like protein binding, we're seeing a lot more transporter protein, especially PGP research into herbs, and know quite a few herbs that may interfere with drugs in this risk area. I think we know more about cytochrome P450 interactions with herbs at this point, but we're getting a lot of information on PGP and herbs as well. So when I'm looking at drug-herb interactions, I spend a lot of time on the drugs, the protein binding and the cytochrome P450 and the transporter proteins, especially the next one that we're going to be talking about, which is therapeutic index. When it comes to the herbs, really the only two things I have as a possible research at this point is the P-glycoprotein and transporter proteins and the cytochrome P450. And that gives us an idea of sort of the inherent abilities of herbs to interfere, which is why when I'm doing these podcasts for herbs, I always have a drug-herb interactions section, and I talk about cytochrome P450, and if there's PGP issues, I'll talk about that as well. because that's what we know about the herbs. Okay, the therapeutic index, which is the fourth of our four main risk factors here. The therapeutic index, also known as the therapeutic window or margin, is an indication of the difference between a therapeutic dose and a harmful dose. Any drug with a narrow therapeutic index, or in the case of herbs, possibly those that are toxic, could be shoved into dangerous territory with minor interactions. Fortunately, there aren't a lot of drugs that have a narrow therapeutic index. These include lithium or lithibid is the brand name, phenytoin or dilantin, the cardiac glycosides, digoxin, digitoxin, and the brand name being lanoxin, warfarin or Coumadin. I'll tell you, I've done this. I've lectured to, I remember one time I lectured to a crowd of must have been about 100, 150 people on drug-herb interactions. And I said, what's the one drug that we should not mix with herbs? And in unison, everyone said Coumadin. And I said, right, warfarin, because we like to talk in generic names rather than brand names, because there's other brand names other than just Coumadin. And so if we just say Coumadin, we might miss some of the other ones. But if we say warfarin, we're getting all the brand names. And by the way, I said, yes, that's my second drug. We're going to talk about the first drug, which is actually my most concerned drug is actually the phenytoin and dilantin. And we can get into that later, in one of my courses. Theophylline, which is a very seldomly used old asthma drug, and almost the entire class of tricyclic antidepressants, including Elavil. The TCAs, or the tricyclic antidepressants, are older antidepressants, not used very often these days, but there's other uses for them where they can be used, sometimes in certain types of neuropathic pains and other things. So they're used, just not as often as they used to be. While there are herbs that are considered toxic traditionally, there are no further indications of the safety margins of specific herbs. So we know there are toxic herbs. What are some of those that, there's some of the purgatives, Fudza is one of those, some of the purgatives. I don't think traditionally Ma Huang or herb ephedra has been considered toxic, but obviously there's a lot of risks to that, and it is basically banned in all developed countries as far as I know. So I would certainly consider that to be in the toxic category. Now, the thing about the therapeutic index is it really is a direct measurement of the safety of a drug. If you take too much of it, so in the example of warfarin, if you take too much warfarin, so warfarin is an anticoagulant. It prevents clotting, basically. So if you take too much, and if you need to take it, there are frequent reasons for doing that. If you have clots or you have a heart attack or something along those lines, they're not using warfarin as much. We now, just in the last 10 years, we have some alternatives to warfarin. Before then, it was really the big one in the game, and it's still used, relatively frequently. But if you take too much warfarin, you go outside of that therapeutic index or window that we were talking about, you too much, and you over anticoagulate, which means you're prone to more bleeding events, and you can hemorrhage. There's a stroke, a hemorrhagic stroke. There are things like that can be very deadly if you take too much and you go above the dosing of the warfarin. Of course, if you take too little, you're not anticoagulating the way you should be, and the risk of dying and side effects are raised as well. So you really want warfarin to be clearly in that therapeutic window, therapeutic index, not above it, not below it. Otherwise, there could be mortal possibilities. So any herbs or drugs that are thrown in that can throw it out can be very serious, which is why warfarin is certainly one of those drugs that we're very cautious about when dealing with drug-herb interactions, to the point where I'll tell you what, my mom, for a short period of time, she had a clotting event, was on warfarin, I think, for a year or something along those lines. And I was giving her herbs before that. And my mom's not going to sue me. My mom's not going to get mad at me. But I was not comfortable giving her warfarin, not giving her herbs with warfarin, even though I think the potential risk for a drug-herb interaction was actually quite small. But I didn't want to risk it, and so that's where I was. Warfarin's one of those I rarely touch, and if I am going to do anything with it, I want blood work, and so I need to be talking with their doctor, have their doctor on board with all of it as well, because there are blood work to determine, and most of these neurotherapeutic drugs, there's blood work that can tell the levels. All right, I've gone in way too much more in depth, which I was afraid of because I know I teach this stuff all the time. So let's move on quickly. Drug-herb interactions. Well, there you have it. 4 areas where the risk of drug-herb interactions is increased. That 5th risk, sort of, it's not really a risk factor. Like, these are kind of quantifiable and demonstrable and researched. There are also, that 5th one is there are individual idiosyncratic drug-herb interactions, which may involve some of the actions of the drugs and herbs, or may just be something unique between an individual drug and herb, just because some of the chemicals kind of mix up some way. So, for example, I just, again, for sort of an extravagant example, is warfarin is, I don't like the word blood thinner, the use blood thinner, it's an anticoagulant, but we have herbs that we say are move the blood or blood regulating. And we often say those are kind of in the realm of herbal blood thinners. Those, even if there's no interaction chemically between those, they're having the similar effects and they can add up, and that's not a good idea. Another one, which we talked about in our last episode, or the episode before that, was with phelgm, which we talk about as an herbal diuretic sometimes. And so some of the herbal diuretics, and you're mixing them up with actual diuretics, that could cause a drug-herb interaction, even though there may not be a chemical reaction causing it, none of those other risk factors causing it. So while drug-herb interactions are certainly a consideration when suggesting herbs when one is taking a pharmaceutical, they actually are quite rare, and many are even beneficial. When you actually look at this and look at drug-herb interactions, often they can be in the beneficial side of things. It should engender some research. If you're giving herbs to someone who's on a pharmaceutical, or you're on a pharmaceutical and want to take herbs, it should engender some research. You should do some research and a little concern. We don't want drug-herb interactions if we can avoid them, and some of them can be quite serious. But the risk is probably minimal in most cases. I think a lot of the risk has been overstated. The risk is there. I don't want to say it isn't, but with just a little bit of knowledge and research, most of that risk can be mitigated. I go into this topic in great depth and discuss how to deal with a suspected drug-herb interaction in the second course of my drug series, Drug-Herb Interactions in the Matrix. Again, that's all available at www.integrativemedicinecouncil.org. And with that little something different, let's get into today's herb. Today we're going to be talking about juhong, or red tangerine peel. Now, this is going to be a relatively, I'm going to talk it out, but there's not a ton of information necessarily on juhong directly, and I was a little surprised by that. So just a little, I was kind of shocked that there wasn't a lot on juhong, and here's the reason why. I remember I was in one of our formulas classes, and when I was learning Chinese medicine. And we learned about a formula called tang. And I had seen that formula or, combination or whatever used a lot in the clinic. Up to that point I hadn't studied it or anything, but I had seen it a lot. And they always use chen pi, which we're going to talk about as one of the herbs in that. And when I looked it up, it actually said traditionally juhong is used, but in modern times, often chen pi is substituted for juhong. So I'm like, interesting. This is interesting stuff. Like, why aren't we prescribing juhong? And did I just get a little bit of it's not really secret because it's in the textbooks and everyone can read it, but is this like a little thing that I can do a little bit different, maybe make things a little bit stronger? And so I'm like, okay, this is kind of a really interesting thing. And that's one of the reasons why I really wanted to talk about this on Spurbs Herbs and bring it up here. And so I got to say I was a little disappointed at the sparsity of information, but there's enough. There's plenty of information. It's still a really interesting herb. You're just going to find several of the normal areas I talk about. I go, well, there was nothing in the textbooks on this, so I can't really, and I couldn't find anything outside. So, but let's get into it. And you have a little bit of a reason why I do this, why I chose this herb. And we're also, as we're going through this, we're going to be comparing it to chen pi because it actually is a supplement under the chen pi monographs. So it's like you have this several pages of chen pi. Chen pi is a major herb in Chinese medicine, and lots of information on chen pi. And then there's like half of a page on Juhong, a little supplement saying, okay, this is very similar, has the same sort of actions, but it's a little stronger here. And that's really what you get about Juhong. So not a lot about Juhong, but there's another supplement that's also behind chen pi on all of the texts, which is Hua Juhong. So Juhong is red tangerine peel. Hua Juhong is pomelo peel. Pomelos, if you're not familiar with them, they're citrus fruit, as are tangerines. They're giant, and they have really thick, at least the ones I've had, and I've had quite a few, very thick peels to them, giant peels, like inch or two peels to them. And I always say they're kind of a cross between an orange and a grapefruit in taste. There's a little bit of the grapefruit bitterness, but some of the orange sweetness. Really nice. I really like pomelos. They're really an interesting fruit. And so that's Hua Juhong is the peel from pomelos, and we're going to be talking about that a little bit as we go along here as well. But let's get back to Juhong, red tangerine peel. The family is the Rutaceae family, and all those things I just discussed are in the Rutaceae family. The species is Citrus reticulata blanco. The medicinal part is the peel, and as Bensky says, remember Bensky and his team is one of our major textbooks that we use here. They say this is the red outer part of the tangerine peel, which is also known as the flavido. And the English translation for Juhong is really simple, tangerine red. So Ju is tangerine and Hong is red. Other names include tangerine flavido, yun pi, chuan yun pi, yun hong pi, and in Japanese kikyo, and in Korean kyohong. Again, I don't know how to pronounce Japanese or Korean, so please forgive my butchering. Bensky and his team say the dosage is 3 to 9 grams, and Chen say the dose is 3 to 10 grams, which is normal. I think, again, just slight differences. And, traditionally, Chinese measurements would be equivalent to multiples of 3 grams. But in modern days, I think Chen does a little bit more modern, 3 to 10 grams of that dose. This herb is a supplement and very similar to the very important qi regulating herb chen pi or Citri reticulata pericarpium. So not rubrum, not red, just the regular tangerine peel, basically. That's chen pi, as I mentioned earlier. Let's talk about that Rutaceae family a little bit here. So the Rutaceae family is commonly known as the rue or citrus family and has about 160 genera. They are flowering plants with 4 or 5 part flowers, usually with strong scents. And remember, we're going to talk later, because there's a strong scent, that means there's volatile oils. That's usually what gives scents off. There are other compounds, but we generally group them as volatile oils. As the citrus family has many well-known plants, including orange, lemon, lime, grapefruit, and tangerine. They also include the Xanthoxylum genus, which includes Sichuan pepper, which of course is such an important part of Sichuan food. Love it. We do Sichuan hot pot. Well, actually, it's a Mongolian hot pot, but it has Sichuan peppers and it's great. The leaves are usually opposed in compound and without stipules, so they don't have little pieces on the bottom. The flowers are hermaphroditic and usually pollinated by insects. So hermaphroditic means they're both sexes. So what that basically means is you don't need a tree that's male and a tree that's female. It's all in one tree. So in the flowers, so they're hermaphroditic and usually pollinated by insects. The fruit are very variable. They go everywhere from drupes, which are basically berries, to, as we know, fruits and things along those lines. So lots of different types of fruits come off of plants from the Rutaceae family. So that's just a quick snapshot of the Rutaceae family. Let's talk about the category of Zhuhong. Bensky and his team put this herb in the herbs that regulate qi category. There are no subcategories to this category. Chen say it is in the qi regulating herbs category, and Brand and Wiseman say it is in the qi rectifying medicinals category. So again, all say exactly the same thing. I'm sure if you looked at the Chinese, it's all exactly the same Chinese. They're translating it slightly differently. And I think there's information to gather from those differences of translations. So I always like to put those in here. Bensky and his team say it's acrid or spicy. So same acrid, spicy, same flavor, and bitter, and has a warm temperature and enters the lung and stomach channels. And both Chen and Brandon Wiseman agree with that. So they both agree with that. So spicy and bitter, warm, and lung and stomach. Both Bensky and his team and Chen say the original source for this herb is Yi Shui Qi Yuan, or Origins of Medicine by Zhang Yuan Su in the Yuan dynasty, which was from 1279 to 1368. You know, I keep saying one of these days I might get into some of the history of the dynasties when we talk about this stuff, because it's fascinating. The Yuan dynasty is really fascinating dynasty. It's a short dynasty, as you can see here. It's you know, maybe it's almost 90 years, right around 90 years long, which is relatively short for a dynasty, but it was also the first dynasty where outsiders took over China. The Mongols took them over. If you kind of go back to your history, this is the age of the Mongols, where they actually went over and almost took over Europe. Fascinating history there. So anyways, that's the Yuan dynasty. So let's talk about the category, herbs that regulate the qi. So according to Bensky and their team, they always have great introductions to the category. So that's why I often quote them. Herbs that regulate the qi facilitate the proper workings of the qi dynamic, or qi ji, also known as the qi mechanism, thereby helping it work smoothly and freely as a means of eliminating qi stagnation or rebellious qi. The qi dynamic plays an important role in Chinese medicine, as noted in a passage from the 14th century work, Teachings of Zhu Danxi. If you're not familiar with Zhu Danxi, he's definitely one of the great physicians. He was, if I'm not mistaken, he's one of the four great physicians of the Yuan dynasty, you know, the Qin Yuan era. He's fantastic, very well revered into modern days. So he said, or this book I should say, when the qi and blood are flush and harmonious, the myriad diseases cannot arise. Once they become restrained and constrained, fu yu, various diseases arise from that. Thus, among the various human diseases, most arise from constraint. So moving on from that quote, most of the herbs that regulate the qi are aromatic and warm, and are acrid or bitter in nature. And we see that here. It's warm, it's acrid, it's spicy and bitter. Aromatic, I would, just because of volatile oils, I would say they are a bit on the aromatic side, even if they don't have that as an actual property. They promote movement, disperse, or drain downward. They are used to promote the movement of qi, reduce distension, smooth the flow of qi, expand the chest, relieve constraint, stop pain, and direct rebellious qi downward to stop vomiting or calm wheezing. From the perspective of the organs, the most important involved in the qi dynamic are the lungs, which govern the qi, the liver, which governs dredging and draining, the spleen, which governs transformation and transportation, and the stomach, which governs receiving and taking in. These functions can be disrupted by a variety of factors: emotional constraint or excessive thinking, overexposure to heat and cold, dampness or phlegm, trauma, or improper diet. When this occurs, these herbs are used to adjust the spleen qi, harmonize the stomach, dredge the liver qi, or regulate the lung qi. The two principal types of dysfunction are stagnation and rebellion. Stagnation is marked by sensations associated with blockage, such as pain, distension, or stifling. Rebellion is manifested in an upward movement of qi, which should otherwise move downward. Belching, nausea, vomiting, and wheezing, together with other forms of dyspnea. Dyspnea means difficulty breathing. There are three major types of stagnant qi, which are differentiated according to the organs that are primarily involved. Stagnant spleen and stomach qi. Symptoms include epigastric and abdominal fullness, distension and pain, belching, gas, acid regurgitation, nausea, vomiting, loss of appetite, and diarrhea or constipation. Second type is constrained liver qi. Symptoms include a stifling sensation in the chest, pain in the flanks, loss of appetite, depression, irritability, and in severe cases, bulging disorders. In women, this problem can also present as irregular menstruation or swollen, tender breasts. And the third major type of stagnant qi is stagnant lung qi, leading to loss of dissemination and descending. Major symptoms include cough and wheezing, accompanied by labored breathing, shortness of breath, and a stifling sensation in the chest. The herbs in this chapter, in this category, are used to unblock stagnant qi, especially in the organs. Continues. Pain occurs when the flow of qi is impeded. Pain due to blockage in the channels can occur anywhere in the body, but is usually found in the head or extremities. Appropriate herbs for treating blockage in the channels are generally those that expel wind dampness. On the other hand, stagnant qi that affects the organs generally manifests as pain in the chest and abdomen. Treatment is directed at reestablishing the natural flow and movement of qi. The herbs here are rarely used by themselves. Rather, they're combined with others based upon the specific nature of the disorder. For example, if stagnant spleen and stomach qi is accompanied by cold dampness, herbs that unblock stagnant qi are combined with others that warm and dry. If there is concurrent food stagnation, herbs that reduce and conduct are added. And if there is also deficiency, herbs that augment and strengthen are added to the prescription. When using these herbs, it is important to remember that most of them are aromatic and dry in nature. Long-term use may deplete the yin. By definition, they also disperse the qi and should therefore be used with caution in those with qi deficiency. That was a good overview of this category of herbs that regulate the qi. And most of what it said is very relevant to our herb today. Certainly gives context to it. I did try to find what is good quality Juhong, and it was not in any of our texts. And I have another text that actually, it's called Chinese Medicinal Identification and Illustrated Approach, that actually is all about looking at herbs and determining if it's good quality or not. And they didn't have a section on Juhong either. So I'm just not again, I'm getting the impression this is it's just not used very often. And when used, usually these days, we're going to find out that Hua Juhong, the pomelo rind, is actually used more commonly than Juhong, the red tangerine peel. All right, let's talk about its Chinese medical action. So according to Bensky and his team, Juhong is more drying and aromatic than Citri, reticulatae, pericarpium, or Chen Pi, but less effective in harmonizing the middle and regulating the stomach and spleen. It is used primarily for vomiting and belching and for treating phlegm, damp cough. So remember at the beginning when I talked about that formula, that Chen Tong formula, which it translates as two cured formula or two peels. Sometimes you hear that too, but two cured is usually the one that I hear. Two cured formula. That is sort of the classic, it's 4 herbs, classic formula for treating phlegm, dampened phlegm. And so you can see here, just in this first little bit on the medical actions, if you have the choice between Chen-Pi and Zhuhong, for the reason of that formula, in that formula, you should certainly use Zhuhong as instead of Chen-Pi to really help that phlegm damp and drying that phlegm down, because that is what Zhuhong is much better at than the Chen-Pi. On the other hand, if you want a little bit of that, or maybe not as strong, but you also want to help the middle, then Chen-Pi would be a good substitution for it. Chen say its functions to regulate qi, open the middle jiao, and dry dampness. It treats cough with profuse sputum or food stagnation with no heat symptoms. Because it's warm, we don't want there to be heat because it will make it warmer, hotter. In comparison to Chen-Pi, Zhuhong has a stronger drying and aromatic effect. Again, that was from Chen, and it's almost word to word what Bensky said and his team said about this herb. Finally, we have Brandon Wiseman, and they say it rectifies qi and loosens the center, also dries dampness and transforms phlegm. And here's a quote from them: "It is suitable for cough with copious phlegm and for food accumulation, but only in the absence of heat signs." So again, almost word for word what Chen say. And I strongly believe that Chen and Brandon Wiseman have the exact same Chinese text that they're going for. Their translations are often similar. And I'm pretty sure that Bensky has the same one, but he does more of his own translations of it than Brandon Wiseman and Chen, I think, are a little bit more direct translations. So that's Chinese medical actions. Preparations. Again, since this entry for this herb is a small supplement to Chen-Pi, there are no entries on preparing this herb in any of our major texts. Chen will sometimes have preparation notes, but Bensky always, they have a section called preparation under their herbal monographs, and there just wasn't one in this case. So again, what is this usually used for? It's usually used in decoctions in general, at least modern days. It can be used powdered, but because it is aromatic and may have some volatile oils, it doesn't say anything about this, but I would question whether we want to add it towards the end of a decoction. Generally, volatile oils are called volatile oils because they're volatile, which means that they can escape with just a little bit of heat. And so generally with aromatic herbs and with herbs with volatile oils, we add them towards the end of the decoction so that we don't get rid of all the volatile oils, which are usually quite helpful in the context of the formula. So unfortunately, don't have a lot on this, but I would certainly consider adding this in towards the end of a decoction. Western uses for this herb. As you can see, it's not a super popular herb in Chinese medicine. It's not a commonly used herb in Chinese medicine. I think it's an important herb, but it's not a commonly used one. It appears this herb is primarily a Chinese herb, and it was difficult to find any Western herbal entries on this herb at all. I did a web research, and it was all Chinese stuff. The PDR for herbal medicines, which is, has some of the major Chinese herbs, but generally is much more of a Western approach, does not mention this herb at all. So I just wasn't able to get any use of these in sort of Western herbal traditions. And similarly, because it was just a small supplement to Chen-Pi, there were no commentaries on this herb in any of our major texts. I really like the commentaries because they really kind of fluff out what we know about an herb, and there just wasn't anything here for this herb. However, there was information to compare with other herbs. We've already done that. We've already mentioned this is considered to be a supplemental herb to Citri, reticulatae, pericarpium, or Chen-Pi. As we mentioned, Zhuhong is more drying but less harmonizing and regulating. It's best used for vomiting and belching and phlegm damp coughs. That was all repetitive. Bensky says Citri, Exocarpium, rubrum, or Zhuhong is less effective than Citri grandis, Exocarpium, Hua Zhuhong, as I've been mentioning that herb as we go along. Today, Zhuhong is used only in Sichuan and some parts of eastern China. Citri grandis, Exocarpium, or Hua Zhuhong is pomelo flavido and has the same properties, actions, and channels with the addition of entering the spleen channel. So it's just a little bit stronger than Juhong. So really, and this was another one of my surprises as I was going through this. I love being surprised when I go through these herbs. Is when I talk about Juhong with some of my mentors. I remember one of them said, "Oh yeah, that's pomelo rind." And I just accept that. Maybe it was pomelo rind in a previous version of Bensky's, but now it's not. It's red tangerine rind, and the actual pomelo rind is Hua Juhong. And so what that tells me is that when it was used, this particular person, I can't remember exactly who it was, but I know it was one of my Chinese mentors, herbal mentors, and they said it was pomelo rind. So I'm assuming that they just called it Juhong, not Hua Juhong, and that's what they used. So really, this red tangerine pill is just not used very often, and this from Bensky makes that clear why, that it's really only used in the Sichuan and some other parts of eastern China. Again, because of the paucity of information, there were no combinations noted in any of our texts, which is something we usually will discuss. But there was enough information on contents. I got a lot of information on contents of this. As this is in the citrus family, there are lots of volatile oils as a constituent of this herb. And like I said, often volatile oils are a major constituent for the herbal properties. So I certainly think those tend to be important when we see those in herbs. According to Bensky, there are also flavonoids, including naringin, hesperidin, panserin, and tangerine. The tangerine is an important one. We're going to see that in just a minute, why that can be important, so keep that in mind. Alkaloids are there, and other constituents include pyrocatechol, lycopene, if you're familiar with tomatoes and lycopene. I don't know how much of these constituents are there. This just is usually a list, and I don't think there's a ton of these, but glycine, beta-sitosterol. We've mentioned beta-sitosterol quite often. It's often an aspect of herbs that carry some of the herbal properties. Has proteins, fats, nicotinic acid, which is, I think, vitamin B6. Don't quote me on that. I can never keep the numbers correct, but it's one of the B vitamins. And vitamin B1, vitamin B2, and vitamin C, which we would expect from citrus fruits. The science, while Chen and Chen has numerous pharmacological effects and research studies for Chen P, they did not include any in the Juhong supplement. While many of these may be relevant to Juhong, that would require some inference that I'm not comfortable with, so I don't want to talk about those necessarily. I did do a scholarly search on Juhong, and there were many studies, but most were not relevant, and those that were simply focused on the constituents of Juhong. There's a lot of research going on what makes up these herbs, and so there was a lot of that sort of research with Juhong. There are no clinical studies on Juhong found on an admittedly cursory search. I went into Google Scholar and went into 50 studies, and I didn't really see anything clinical regarding Juhong. There's one interesting study, did look at herbs used to treat COVID-19. So this was a study that looked at what the literature and what people use to treat COVID-19. And Juhong was mentioned. I think it had 3 mentions, which was not many, so not often mentioned, but it was in there in the realm of being used for COVID-19. And you think about it, damp, phlegm, cough certainly could have its place in treating COVID-19. But there was no data. This is just sort of a cross references of what were mentioned as treatments for COVID-19. There were no data discussing its effectiveness. We don't know if it helped or not, but theoretically it would. Drug-herb interactions. There was an interesting study. The authors mapped constituents in grapefruit juice known to have strong inhibition of cytochrome P453A4. In fact, I think we went down the road of cytochrome P453A4 by realizing that grapefruit juice inhibited statin drugs. And so I think that's what happened historically. I'm not entirely sure. So we started looking at grapefruit juice and realized it strongly inhibited cytochrome P453A4. And so now if any drug says should not take with grapefruit juice, there's cytochrome P453A4 interactions going on. So they mapped the constituents in grapefruit juice to other citrus fruits and components, including Juhong. And they did find numerous overlaps with potential cytochrome P450-3A4 interactions, but primarily Tangerine, that was that constituent I mentioned earlier, had some potential inhibition. Again, as I mentioned at the beginning, it's one component, so it doesn't necessarily mean that this herb has cytochrome P450-3A4 interactions, but I would at least take it into account that it might. The American Herbal Products Association's Botanical Safety Handbook, I love this, by Gardner and McGuffin. They classify an herb's potential for interactions. They did not have a specific entry on Juhong, but did say Chen P is in interaction class A, or herbs for which no clinically relevant interactions are expected. So that's their highest rating. And so while there's potential for a little bit of drug herb interaction here, I don't think it's major. I don't think it's a huge concern. Speaking of concerns, what are some concerns about this herb? Bensky et al. Does not have any cautions or contraindications for Juhong. They do have some concerns for its common replacement, the Citri grandis Exocarpium, or the Hua Juhong, the pomelo flavito that we talked about, and say for that, because it is quite warm and dispersing, it is not indicated for those with qi deficiency or dry phlegm with yin deficiency. And Chen have the exact same concerns there as well. So we should be cautious with using this herb with qi deficiency or yin deficiency. That was good. So we started today by looking at an important topic that has slipped through our lens until today: risk factors for drug herb interactions. Then we looked at the Chinese herb Juhong, Citri reticulatae Exocarpium rubrum, a qi regulating herb whose strength actually lies in its ability to treat phlegm, damp coughs, and vomiting and belching. It was an interesting journey looking at a relatively important herb that is not used much in modern Chinese herbalism. And that was another jam-packed look at some fascinating Chinese medicine. I hope you guys enjoyed it. In our next episode, we will be looking at another traditional herb, in this case more of a Western herb, chamomile. Super common. This is a very commonly used herb for relaxation to help sleep. But are there any concerns or other uses for this herb? What about science behind it? We are going to be finding out in short order. And as usual, we will be adding something a little different. Please join us for our next episode. It's going to be another great one. And thank you very much for listening. If you liked this podcast, please do us a favor. Subscribe in your favorite podcast app. We would be really appreciative if you were to do that. And you can get this course as continuing education, get more info on my upcoming integrative nutrition series at www.integrativemedicinecouncil.org. You can always get in touch with me at drgreg@spurbsherbs.com or at our website, www.spurbsherbs.com. And that's where you can go to the shop and get those 2 books we mentioned at the beginning for 10% off. And as usual, we have our bibliography. Thank you very much.
Spurbs Herbs. The proceeding was presented by Dr. Greg Sperber. We would like to thank Janelle for all her support and everybody else who contributed to this program.
Janelle.
Timothy
Nick
Dobbins,
Rogers,
Campbell,